What's your name, your occupation, and where do you work?
My name is Cheryl Heron. I am a physician, an emergency medicine physician, actually, in the Department of Emergency Medicine. I am also one of the assistant deans in the School of Medicine, and I am the co director for the Violence Prevention Task Force for the Injury Prevention Research Center at Emory.
Awesome. How would you describe your occupation to someone who's not familiar with injury prevention or public health?
It's a great question. In 1996, when I arrived at Emory, I actually came as a fellow, and I did my fellowship in injury control at the time. So I came aboard and had an interest around partner violence and the prevention of partner violence. And so, unlike many who finished their residency training, I actually took an additional year of training, which essentially was a pay cut, really, to come to Atlanta to work with Arthur Kellerman, our founding chair. I think I was, if not the first fellow injury control prevention. And from that, my lens was opened from the standpoint of my interest being looking at partner violence and the causation thereof, more importantly, the prevention thereof. And as a healthcare professional, how do we prevent that? So my MPH coupled with my emergency medicine training opened my eyes to the lens that we can really focus on, which is how do we prevent harm? And in my case, it was how do we prevent harm in a domestic violence scenario? And in my case, I can tell you that the juxtaposition between emergency medicine and public health and then injury prevention became palpably clear.
Mm. And Cheryl, can I ask, what would you say to students who feel like they have to choose between going the medical route or going the MPH route and they're not quite sure what to do?
Yeah, so I had that very question. I'm a little bit of a different sort of foray into medicine. I did my master's in public health first, public health being sort of population-based, community-based, and realized along the way, of which I really took 6 years off between undergraduate school and medical school, in between which I did my master's in public health. I became very much aware of the boots on the ground, sort of the one-on-one engagement that I would then become accustomed to, i.e. working with patients. And I like to remind people it's not really an either or scenario, because I have both a medical degree and a master's in public health degree. I really see those as sort of a partnership and co-joined. And if you have an MD degree and you don't have the MPH degree, it doesn't preclude anyone from engaging in public health prevention. If you have a public health degree and you don't have an MD degree, it shouldn't preclude you on engaging in public health prevention in areas that one is interested in. So I would say to any student or anyone, you go where your heart lives. And if your heart lives in caring for people, for caring for humanity, for engaging in any one of those spaces, that's where your heart lives. And as you get experience, and I will absolutely say, injury prevention certificate will give you experience, life will give you experience, you can find where your true north is.
Awesome, that's great. Alicia?
What are some of your day-to-day tasks or roles in your position?
Oh, wow, that's a big question. So, I have to jokingly say and interject here that I'm a Jamaican, and for those who don't know, it's a Jamaican, Jamaica country, not Queens, but Jamaica, raised in Brooklyn. And my day-to-day tasks are just enormous, right? So I can start from the role of as a physician. We are currently, as of this videotaping, in the COVID-19 pandemic, which has been sobering at best, to be on the front lines to care for individuals who have been either exposed or think they're exposed to a virus that, as you know, has tremendous implications, not on just the individual, but on society. So on the day-to-day basis on that question, where I actually worked in the emergency department over the weekend, I actually did care actual care for patients who came to the ED sick. In addition to that, because of my public health lens, I'm always looking at the societal needs and the community implications of how to help, right? So public health is around prevention, right? It's around all of the models. What are the resilience factors? What are the protective factors? All diseases and manifestation thereof are surrounded by those constructs. So I bring a different lens there. So while I'm working clinically, I still bring in my public health lens into that scenario, right? In my role as a vice chair for faculty equity, engagement, and empowerment, I had to change my title this year. I really believe that in that role, I assist our faculty members in becoming their best selves. That's essentially the nuts and bolts of it, in the context of equity, in the context of inclusion, to ensuring that all people have a voice, to be able to speak their narrative and make a difference in their community. And then in my hat as an assistant dean in the School of Medicine, I get the privilege of working with our students, medical students in particular, to help them determine their career path and speak with them about the challenges around the multifactorial ways in which the public and public health will inform their practice. And then my last role as co-chair of the Violence Prevention Task Force, because that is an area that I mentioned earlier for me that is resonant, meaning I see patients who are victims of violence come into the emergency department, coupled with my prevention hat of how does this happen? Why does this happen? Are we educated enough to know how this happens, which then goes to the research question and, you know, the scholastic part of what I engage in, where we try to examine these questions from a scientific lens. What is the evidence? How does it manifest? And so that piece of my life has been extraordinarily impactful, because it now has really blended my master's in public health, my MD degree, the subject matter really around partner violence and or violence in communities in general, to hopefully, you know, make a difference in society.
That's great.
Thanks.
What excites you most about your occupation?
Wow, you know, it's sort of oxymoronic, because people say you're an emergency medicine physician. You know, that tell me the glorious thing that you've ever seen, right? And while in full disclosure, that, and it still is, that wasn't the reason I went to emergency medicine. I, in fact, thought I was going to be a family physician. But what excited me more about linking, again, public health to emergency medicine was the ability to be boots on the ground and to affect change. For example, when I take care of patients, I'm able to say to them, did you wear your seatbelt? Right? What is your housing situation? And do you have housing insecurity? Are there substance abuse problems, whether it's alcoholism or other drugs that we can help you through and understand? So what excites me more, and then the other piece of learners, such as those who may listen to this video, is really creating the next generation to start to be thoughtful and engaging and understanding all of these things that impact our community. And that excitement keeps me going every day. I mean, I've been here 26 years. One could argue and one will see that people get jaded, aren't excited about what they're doing, but because of all of these areas in which I can engage, my tank is filled each time, and I get excited about the future.
Awesome. What would you say to a student who's considering applying for the Injury and Violence Prevention Certificate program?
Well, I mean, I know Nike said it, but just do it, right? I mean, I will give them the credit behind that. And, you know, why I say that, all jokes aside, is because it will give our students a foundation to understand why it matters, right? I did an injury control fellowship, which is sort of the next phase or the next step, where I spent a year really augmenting the knowledge base that I had around injury, particularly family violence and partner violence. And the certificate program really is that entree It really opens the eyes of students. It more importantly has students ask questions, right? One never knows the answer unless you ask the question. And to have a curious, thoughtful assessment of what's happening where one can be involved in, right? Because we're all part of this human condition. We're all the public. We're all part of and have been exposed to injury, whether it's intentional injury, unintentional injury. We all are facing these realities. And students who can engage in this to build their knowledge base, as well as their ability to then work with an immense community of servants, if you will, because we partner with organizations that are nationally known, that are locally known, that are engaged, boots on the ground, outward outpouring of work. It's really exciting to do that. And the certificate program will allow students to have access, really, which is what life comes down to. You have to have access, and therefore engagement, and then therefore empowerment to be able to change the world.
If you're interested in applying to the IVP certificate, then email Dr. Dorian Lamis. You can also learn more about the certificate by visiting us on our website or social media.